So before entering the room to introduce yourself to a patient, the first thing you want to do is gather information about your patient, such as their name, what you're going in there for, their current condition, as well as how they're going to communicate with you. So if they have any impairment issues or speech or hearing issues, as well, they might speak a different language. So you just want to know how you're going to communicate best with them before entering the room. So before entering the room, we're going to wash our hands with proper hand hygiene, just so we're not bringing any microbes or soil into the room. Make it nice and safe for the patient. So then once we're in the room, we're going to do a scan of the room or a general survey to see if the patient's showing any visible signs of distress, whether they're breathing super heavy or they're showing like they're in a lot of pain. And we're going to be doing that the whole time we're in the room as well with them. We're also going to check for hazards around the room, like if there's water spills or if there's anything out of reach for the patient. And again, we'll be doing that the whole time we're in the room as well. Then we want to get their attention. So that would be saying their name, seeing if they respond. If they're not waking up through auditory cues, it might be tapping on the shoulder. But with both methods, we want to make sure we're definitely getting their attention. So whether that's them responding to you verbally or with eye contact. But we want to assume, we don't just want to assume that they know we're there. We want some kind of verification. So the next thing to do is to introduce yourself. So I would say, hi, my name is Sarah. Like, you can call me Sarah. I'll be your student nurse for today. I'm from the University of Manitoba. Then you want to identify your role. So, and who the nurse who's training you perhaps. So I'm here with this person today and we'll be doing this assessment on you. So they're not left in the dark of what's going on with them. You're giving them a nice explanation of why you're there. So the next thing we want to do is verify that the patient that we're supposed to be looking at is that said patient. So we'll ask them their first and last name if they can repeat that to us, as well as checking their wristband to make sure they are who their name matches up with and they're in the correct room. If everything was correct with that, we'll then start by having a conversation with them about how they are, how their day's going. Has there been any changes in their health? Like, are they in more pain, or has just anything that has come up since the last time they saw a nurse that reason for concern, or just a general to see how they are? It also establishes a nice rapport with them and they feel comfortable. Then you do your assessment or whatever you came to do. And then when you don't need to do anything else, to excuse yourself from the room, you might say, okay, I'm done for today. I will be back at a certain time, or if another nurse will be in. And you want to make sure before you leave that you also see if they need anything before you leave, because they might need water to go to the bathroom. So you just want to make sure they're comfortable when you leave and they're not left in the dark about when they'll be checked up on next. So when leaving the room, if you've touched anything, we're going to wash our hands again before we leave the room to exit.